actually outside today, so enjoying this beautiful morning. So as Ursula said, I'm the founder and director of the Prenatal Yoga Center, labor support doula, mother of two, Lamaze teacher, and obviously prenatal yoga teacher. So I want to talk a little bit about how childbirth education can lead to the satisfaction of one's birth. So not that long ago, I remember having a student, and she and I actually went through our second pregnancies together, and our due dates were really close, and she talked to me a lot about how she was really scared about birth, which is quite normal. A lot of women have a lot of fear around the birth. And so I started talking to her like, what have you done? Have you taken childbirth education classes? What preparation have you done to help calm your fears? She said she and her husband thought the best thing they could do is just kind of listen to everything their doctor says, and they're not going to take the classes, just put 100% of their trust in their care provider. So it's really interesting because this came up right before class. So there was a part of me that wanted to jump on my soapbox and be like, childbirth education, let's talk about that and why it's so important. So instead of doing that, I actually opened it up to my students. And we had about 20 students that day, and many were second-time moms. So I just opened a casual conversation saying, so out of the moms that have given birth, how many took childbirth education classes? In fact, all of them had. And I said, do you want to give any feedback of what that class did for you? And so many of the moms said it created a sense of confidence. Some of the moms said that it helped them connect to their partner and help their partner relieve some of their fears around it and help their partner feel like they can get more involved. So overall, it was a really great impact that the childbirth education class had on the couples and in their mental preparation for what was ahead. So then after that class, I went home and I wanted to do a little bit of studies on have there been any formal studies on this. So I researched a bit and I came across some very interesting information. So one came from the Lamaze Institute, and it was called The Patient's Perspective on the Role of Prepared Childbirth Education in Decision Making. Now granted, this particular article had a lot about the decision making for elective induction, but I still think it's informative to see how the childbirth education helped the women prepare and if they felt more confident with their choices. So what it started to explore is that from 2005 to 2001, there was a major shift in how many women actually took childbirth education classes. So in 2001, about 70% of first-time moms took childbirth education. And then now in 2005, granted that's still 10 years ago, so I'm curious what the numbers are now, only 56% of first-time moms took childbirth education. The article also explored where the women were getting their information. So if they weren't taking formal classes, where were they getting it? A lot were getting from friends and family, just kind of anecdotal information. A lot were getting from the internet, and a lot were getting from their care providers. And what the article was starting to say is that the women are feeling less confident in their decision making because they didn't really have that education. They didn't have the background to make informed choices. And so a lot of the women were feeling that from the lack of information, there's a lot of fear around the choices they were making. So I actually pulled some statistics from that article that I thought would be really interesting. So 19% of the women who did not take childbirth education felt ill-equipped to make decisions. That's compared to 11% who did take classes. 57% of the women who did not take classes wish they had more specific information and instruction. So that's 57%. That's a lot of women that didn't take childbirth ed had wished they had, compared to the 16% of women who did take class wish they had more information. So just on that article alone, we can already see that more women that were taking classes felt that they had more satisfaction and more information. One more article I just want to talk about was from the Journal of Perinatal Education. It's called The Lived Experience of Knowing Childbirth Education. So it's really about women trusting their instincts. And I think that's one thing that education can help. I think it can really help women to say, wow, I have this information, I'm learning about my body, I'm learning about the process, I'm really learning to trust what my body's capable of. Because when the education's given, women often just feel more confident. So with childbirth education dropping, women are slowly relying on their doctors, and they may feel that they're not involved in the decision making. And when they're not involved and they're just kind of going along on the roller coaster of birth, they could often feel unheard after. They can often feel that they didn't really know what was happening to their bodies and happening to their birth, and they were more just a piece of the equipment happening instead of the mom birthing her baby. So just from those two articles and kind of our little informal study of in our class, I feel confident that when women take childbirth education, they're going to feel more involved in their birth. You're going to feel more satisfied with the outcome, even if it went unplanned. So it may not go exactly how perhaps you pictured it, but when a woman's more involved in the decision making, she's often more satisfied with the birth. When she's more satisfied with the birth, usually it's an easier road into motherhood. So I hope those moms out there that were maybe on the fence find a way to take childbirth education. If you can't actually get to a class, there's wonderful online classes that you can still take. So educate yourself, enjoy your pregnancy, and enjoy your birth. Happy birthing. Have a wonderful morning. Take care.